Your home blood pressure readings might be lying to you right now, and the worst part is, you have no idea. Here are 10 common mistakes people make when measuring blood pressure at home. Some of them even happen in doctors' offices. These errors can give you completely false numbers. A reading that is artificially high might lead to an unnecessary diagnosis and medication you don't need. A reading that is artificially low might let real high blood pressure go completely undetected. Both situations are dangerous, and both happen far more often than people realize. My name is Dr. Hidden Stories. A blood pressure reading is only useful if it is accurate. An inaccurate reading is not just unhelpful, it is actively misleading. It can lead to the wrong treatment decisions, unnecessary worry, or a false sense of security that puts your heart, brain, and kidneys at silent risk. That is why I want to walk you through all 10 mistakes today. Stay with me until the end, because mistake number 10 is the one almost no one talks about. Yet it changes everything about how you should interpret your readings. Before we get to the mistakes, let me explain why accuracy matters so much. Blood pressure is the force of your blood pushing against your artery walls with every heartbeat. It is recorded as 2 numbers. The top number, systolic, measures the pressure when your heart contracts and pushes blood out. The bottom number, diastolic, measures the pressure when your heart relaxes between beats. A single, inaccurate reading can be the difference between your doctor adjusting medication or leaving it unchanged, between you feeling confident or missing a real warning sign. Every detail of how you take the measurement affects the result. Let me tell you about a patient I will call Mr. Harlan. He was a 72-year-old retired accountant who was extremely careful about his health. He measured his blood pressure every single morning and recorded every number in a notebook. His readings were consistently around 152/94. He was already on one medication, and those numbers made him worried that it was no longer working. He came to see me convinced he needed a stronger dose. When I asked him to show me exactly how he took his readings at home, I spotted 6 separate mistakes in the first 3 minutes. 6 errors that together were adding 25 to 35 points to his systolic number. When we measured his blood pressure correctly in the office, the reading was 127/81, completely appropriate for his age and health profile. He did not need any medication change at all. We will come back to Mr. Harlan, but first let's go through every mistake so you never find yourself in the same situation. Mistake number 1, placing the cuff over clothing. This is one of the most common errors. The cuff must always go directly on bare skin. Even a thin shirt sleeve creates resistance and uneven pressure. Studies published in Blood Pressure Monitoring show that measuring over clothing can artificially raise the systolic reading by 10 to 20 points, enough to push a normal reading into the hypertensive range. Always roll up your sleeve completely or remove it before placing the cuff. Mistake number 2, arm not at heart level. Your arm must be supported at the same height as the center of your chest. If your arm is hanging down by your side, gravity pulls blood downward and increases the pressure the cuff detects. This single positioning error can raise your systolic number by 10 points or more. Rest your arm on a table or firm surface so the cuff sits level with your heart every single time. Mistake number 3, measuring without resting first. Blood pressure rises and falls throughout the day based on activity, stress, and even conversation. If you measure right after walking, climbing stairs, eating, or an emotional moment, the reading reflects that temporary change, not your true baseline. The American Heart Association guideline is clear. Sit quietly for at least 5 full minutes before taking a reading. No talking, no phone, no stress. This one habit alone can lower artificial elevations by 5 to 15 points. Mistake number 4, sitting with an unsupported back. If you are perched on the edge of a chair with no back support, your core muscles stay tense to hold you upright. That mild tension raises blood pressure. Sit in a chair with full back support, feet flat on the floor, legs uncrossed. Your back should be comfortably resting against the chair from the beginning of your 5-minute rest period until the reading is finished. Mistake number 5. Crossing your legs. This error is so common that even some doctors do it in clinic. Crossing your legs at the knee compresses blood vessels in the lower limbs and redirects blood volume upward. Research in the journal Hypertension shows this can raise systolic pressure by 2 to 8 points and diastolic by 3 to 8 points. Keep both feet flat on the floor, always. Mistake number 6. Using the wrong cuff size. Cuffs are not one size fits all. The inflatable bladder inside must cover at least 80% of your upper arm's circumference. A cuff that is too small gives artificially high readings. One that is too large gives artificially low readings. Most standard home cuffs fit arms between 22 and 32 centimeters. If your upper arm is outside that range, you need a different size. Ask your pharmacist or doctor to measure and confirm the correct cuff for you. If you have made it this far, you are clearly serious about getting accurate information. But most viewers enjoy the content and scroll away without subscribing. If this video is helping you, tap subscribe right now. It takes 1 second. If not, you will probably forget this channel exists and miss important information coming up. Mistake number 7. Talking or moving during the measurement. Any movement or conversation while the cuff is inflating raises your blood pressure instantly. One study in the Journal of Human Hypertension found that simply talking during a reading can increase systolic pressure by an average of 17 points. Stay completely still and silent from the moment the cuff starts inflating until the reading finishes. Mistake number 8. Relying on a single reading. Blood pressure fluctuates naturally from moment to moment. The American Heart Association recommends taking 2 to 3 readings, 1 minute apart, and averaging the results. The very first reading is almost always higher because of mild anticipation. Discard the first reading if it is significantly elevated, and use the average of the second and third as your true number. Mistake number 9. Measuring at inconsistent times. Blood pressure follows a natural daily rhythm. It rises sharply after waking, peaks in the late morning to early afternoon, and drops in the evening. If you measure at random times, you are comparing numbers from completely different points in your daily cycle. Choose one consistent time, ideally first thing in the morning before medication or food, and stick to it every day. Consistency turns home monitoring into reliable clinical information. Mistake number 10. Ignoring the difference between white coat and masked hypertension. This is the mistake almost no one talks about, yet it has the biggest clinical consequences. White coat hypertension is when blood pressure spikes in a medical setting because of anxiety, but is normal at home. Up to 30% of people diagnosed in a doctor's office actually have normal readings at home. The opposite is masked hypertension. Readings look fine in the clinic but are significantly elevated during normal daily life at home. This affects up to 17% of adults over 60 and is especially dangerous because it goes undetected. Accurate home readings taken correctly over time give your doctor information that a single office visit never can. If your home readings and clinic readings consistently disagree, tell your doctor. Ask about a 24-hour ambulatory blood pressure monitor, the gold standard for sorting out these patterns. Let me bring all 10 mistakes together clearly so you can remember them. Cuff over clothing, arrow always on bare skin, arm not at heart level, arrow rest, arm on table at chest height. No rest period, arrow sit quietly for 5 minutes. Unsupported back, arrow full chair back support, legs crossed right. Arrow feet flat on floor, wrong cuff size right. Arrow confirm, correct size for your arm, talking or moving. Right arrow complete stillness and silence, single reading. Right arrow take 2 to 3 readings and average the last 2. Inconsistent timing, right arrow same time every day. Ignoring white coat or masked hypertension leads to compare home and clinic readings honestly with your doctor. Now go back to Mr. Harlan. After our visit, he corrected every mistake. He rolled up his sleeve, rested his arm properly, sat quietly, kept his back supported, stopped talking during measurements, used the right cuff size, and began averaging multiple readings at the same time each morning. His new accurate home readings, averaged 126/80. He had spent 3 months worrying unnecessarily and nearly increasing medication he did not need, all because of measurement technique, not his actual blood pressure. He looked at me and asked, "Doctor, why doesn't anyone teach patients how to do this correctly before sending them home with a machine?" That question is exactly why I made this video. Here is your action step right now. The next time you measure your blood pressure, go through this list first. Check every point before you press start. Screenshot this video or write the 10 mistakes down if you need to. Share it with any family member who measures at home. Which of these 10 mistakes were you making without realizing it? Tell me in the comments below. I read every single one. If this video helped you get more accurate readings, please share it. There are people in your life right now making these same errors and making health decisions based on numbers that are not real. Before you go, remember this: most people keep waiting for the perfect time to take their health seriously, but that moment rarely arrives on its own. That is exactly why I created the 30-day blood pressure reset for seniors, a simple, step-by-step plan with gentle daily routines and clear guidance you can follow at home. I have seen patients feel far more in control and confident in their readings just by following a structured approach like this. I am keeping this very limited. Only 30 spots are available, and several have already been taken. If you are ready to start something consistent and effective, click the link in the description or scan the QR code to secure your spot now. Because you are part of this community, I have made it even easier with a substantial discount, so cost is not a barrier. After you get your copy, you can drop your email and I will personally follow up to help you stay on track. Disclaimer: everything shared in this video is general medical and educational information based on current clinical guidelines and published research, including standards from the American Heart Association and the European Society of Hypertension. It is not personal medical advice for your individual situation. Blood pressure management decisions, including any changes to medication, should always be made in consultation with your own doctor, who knows your full medical history. Home monitoring is a valuable complement to clinical care, not a replacement for it. This is Dr. Hidden Stories. Stay accurate, stay informed, and I will see you in the next one.